So still on the Rcgp case cards, this one says, explain the diagnosis of cystic fibrosis to the parents of a 3-year-old Lily who didn't understand the hospital's explanation. As the hospital doctors have told you, Lily has a condition called cystic fibrosis. This is a genetic condition that mostly affects the lungs and the pancreas, an organ next to the stomach, which is involved in digesting food. A protein in the lungs and pancreas doesn't work properly. The result is that the mucus produced in the lungs, which is normally very helpful at trapping infection, is too thick and is difficult for the lungs to clear. Therefore, people with cystic fibrosis tend to have recurrent lung problems and are more prone to chest infections. The pancreas finds it difficult to produce the chemicals or enzymes which break up food. So people with cystic fibrosis end up not absorbing as many nutrients or calories as they need. This is why Lily is small for her age. We can help the lung problems with a mixture of chest physiotherapy, which you'll be taught to do yourselves, regular inhalers, and sometimes antibiotics. The pancreas problems are treated with tablets to replace the enzymes the pancreas cannot make. Lily will also need more nutrients than other children. A great number of people will be involved in Lily's care. The physios, dietitians, specialist nurses, hospital doctors, along with us, your GPs. So for the pancreatic enzyme replacement, crayon, which is or pancrezyme, is usually used to replace the deficient pancreatic juices or pancreatic enzymes. The next one, and just to mention, cystic fibrosis is inherited as an autosomal recessive condition. So you should be able to explain that if for instance, they're asking how she happened to have cystic fibrosis. So the next card says, give dietary advice on weight loss to a lady with a BMI of 32. Your height and weight measurements today indicate that you are obese. If you are obese, you are at risk of many health problems such as diabetes, joint and back pain, fertility problems, high blood pressure, and heart disease. It is estimated that being obese reduces your lifespan by 7 years. The best way of losing weight is to reduce the amount of energy taken in, that is food, and increase the amount of energy you burn by doing exercise. Your ability to lose weight has a lot to do with your self-esteem, your relationship with food, and how you feel about exercise. The best way to think about diet is to increase starchy foods, such as brown pasta, reduce the amount of fats, like cheese and red meat, and have a moderate amount of protein, like fish, chicken, or pulses. It is important to work out your weaknesses. Questions to ask yourself are, do I need to reduce my portion size, or am I snacking between meals? Don't forget to think about the calories in alcohol and fizzy drinks as well as food. So you can get your calories from food as well as drinks. So you might need to also cut down on certain drinks like alcohol, for instance. This next one says, explain treatment options for dysfunctional uterine bleeding. Heavy periods with no underlying cause in a 23-year-old. We know there is no underlying abnormality causing your heavy periods, but as they are interfering with your life, there are treatments we can start to help you. Your treatments involve hormones. Some treatments involve hormones, others don't. Some are also contraceptives, so the right treatment for you depends on whether you need contraception or not. Many people start with simple anti-inflammatory drugs such as ibuprofen, taken regularly as soon as the period starts. This slows the bleeding and also helps with pain and may be enough to control your symptoms. Another tablet called tranexamic acid also slows the bleeding down by making your blood clot more quickly. This is taken 3 times a day as soon as the period begins, and you can take it with ibuprofen for extra benefit. If you do not need contraception, it may surprise you to know that the top recommendation at the moment is the Mirena coil. That's if you do need contraception, the Mirena coil. Within 3 to 6 months of having one put in, most women settle down to having either very light periods or no periods at all. If the coil isn't for you, we can talk about other contraceptive choices that might help. The important thing is that your periods become acceptable to you so you can live a normal life. What would you like to do next? It's always good to give that option. What will you like to do next? Or what will you like to try at this point in time from everything that I've said? The next one is, explain when to be concerned about vomiting to an 8-week pregnant lady. About half of pregnant women will feel sick at some point in early pregnancy. It's often called morning sickness, but it doesn't always occur in the morning. And for some, it can last the whole day. It's normally gone by 16 weeks, although some women have a degree of sickness all the way through their pregnancy. Feeling or being sick doesn't affect your baby, as long as you are managing to keep something down. Different women find different ways to manage the symptoms of nausea. The most common advice is to eat little and often instead of large meals. Drink plenty of fluid to avoid dehydration and avoid becoming overtired. There are lots of tips out there. Some people swear by ginger biscuits. For some, the sickness can become quite severe to the point of starvation or dehydration. This only happens in about 2% of pregnancies. So a very small amount of women end up in hospital needing a drip. If you feel more unwell, dizzy, or can't keep fluids down, come back and see me. So nausea and vomiting in pregnancy can range from mild to moderate to severe, and